I am Kai Smith, your certified trichologist. I am your hair loss advocate, the author of Discover the Secrets to Healthy Hair. I am passionate about helping women uncover the unknown factors about their hair loss, as well as helping my peers identify hair loss behind the chair and increasing influence and brand awareness within the beauty industry. So we're talking about birth control and vitamin deficiency. I like for you to share this broadcast with your social media following. Sharing is caring, and somebody needs to know this information. If you logged in to get this bit of information, then someone else wants to hear this information as well. And so if I have any beauty professionals that are joining me, this information is so good for you to be able to converse with your clients about things like this with your clients in the chair. If you are a consumer, this is really important as far as what you're taking, so that you know what questions to ask your doctor about birth control pills, or either just any type of birth control. Okay, so birth control is taken, stats say that birth control is taken by 61 million women in the U.S. Birth control is taken by 61 million women in the U.S. Now, these stats might not be as accurate. It may be over 61 million now, because as you know, teenagers age, parents are taking precaution, trying to get their kids protected because they don't know, what's happening. But women or young girls as early as 11, 12 years old are taking some type of birth control pills. And it could be because they have irregular cycles. It could be to prevent pregnancy. It can be for multiple reasons why they're taking birth control pills. Okay, birth control pills, and I don't know if you guys look at it this way or not when we classify prescription drugs, but birth control is considered a prescription drug. So whether you put it in that classification or not, just know from today's broadcast that birth control is considered to be a prescription drug. And like I said, it's taken in early ages by teenagers to prevent irregularity in their cycles, to balance out hormones. Is taken by middle-aged women to prevent pregnancy. Is taken by and also to manage hormones if they have some type of female disorder going on. And it's also taken by women in their latter ages for hormone replacement therapy to balance out the menopause. So the same hormones that are in the birth control for earlier age or middle-aged women is the same hormones that are in, the hormonal replacement therapy as well. Okay. So, overall, and we all know some of this information, overall birth controls, we already know can cause hair loss, right? Can cause hair loss with the increased amount of androgens that are in the bloodstream. But not only can it cause hair loss, it can cause other deficiencies as well. So why is it causing hair loss? That's the big thing for me, is we only think of it as, it's causing hair loss. But remember, hair loss is a symptom to something else. So we've always looked at it as the hair loss is occurring because of the imbalance in the hormones, but the hair loss could be also caused because of deficiencies with vitamins and minerals as well. So this is the information that I want you to take away from this broadcast today when you're taking birth control pills, or if your clients are on birth control pills. This is kind of like a memo. This is a PSA that you guys need to be out there discussing with your clients or consumers. You need to be in your doctor's office asking these kinds of questions when you go in and they prescribe your birth control pill. You just take it. You don't know what level of hormones is in this stuff, and you're just taking it. And so with the oral contraceptive, studies show that deficiencies can range from B vitamins, and there are a host of B vitamins, 6, 12. There are a host of B vitamins that fall within that category. Vitamin C, vitamin E, zinc, selenium, magnesium. These are all of the deficiencies that it can cause just from taking birth control pills. And so with the studies that have been conducted, they've compared blood levels of women who are taking birth control pills to women who are not taking birth control pills. And this is how they've arrived at the deficiency levels, because all of the deficiencies are coming back in the women who are taking the birth control pills. And what happens is the deficiencies can be very subtle. However, since women are taking birth control pills over a prolonged period of time, then it becomes accumulative in the system, and that's how the deficiencies start appearing. And I'm just going to kind of go through what the different vitamins and minerals are for, and the problems that you can have if you are having deficiencies in these areas. So let's start off with the lack of folic acid. Well, as women, we know that folic acid is one of the main things that a doctor will tell you that you need when you're in childbearing age, right? And your prenatal vitamin usually has higher amounts of folic acid in it because you need it for for developing the child. It can cause brain defects and a whole lot of other things when you are when you're pregnant. So basically what the folic acid does, what folate does, is it helps with the DNA synthesis. It helps with the cell division. It affects rapidly growing cells. Hair is a rapidly growing cell. And if it's affecting cell division, then what happens with the cell division within the hair follicle, right? So let's do a little science real quick. And for my hairstylists who are on here, what happens is hair is a rapidly growing cell. Well, the hair is a non-essential tissue. So if the hair needs vitamins, it's going to be the last thing to get it if the body is deficient in other areas. It's going to extract it from the hair and it's going to take it to the other areas of the body where it's needed. So with that being said, if you have a folate deficiency, your hair isn't getting any folate. Your hair is a rapidly growing cell. So there's a deficiency there in the hair, and there's also a deficiency there in the rest of the body. So it's hindering healthy cellular regeneration. So we're talking at a cellular level. I'm not talking about anything superficial with your hair being dry or brittle or the way you're over processing or the way you're styling or none of that. I'm talking about your health. And a lot of us overlook this hair part, and we only think about what we can put on the hair to make it look good instead of what we're putting in our body or what we're not putting in our body to support the hair. And so folic acid will definitely hinder hair production. It's not going to attack the hair cell, directly, but what's happening is if the body doesn't have enough at a cellular level as a whole, then the hair cells are definitely not getting anything that it needs. And so it hinders DNA synthesis. It hinders cellular division. It affects rapidly growing cells. Now, another example of a rapidly growing cell would be your red blood cells. Red blood cells are essential because your red blood cells carry the oxygen within your body to all of the organs, the body systems. So if there's a lack of oxygen in the cells, then more than likely you may run the risk of being anemic. If you're anemic, then you run the risk of losing your hair, right? So this is how all of this bodily function stuff plays into your hair and how it grows, right? And so lastly, like I already said, folic acid can cause birth defects. Right? A deficiency can cause birth defects. It can cause a host of other things, but these are the things that I extracted from the study that I was reading to share with you so that you can see on a smaller scale how a folic acid deficiency could affect not just your body, but it can be your hair loss can be a symptom of a folic acid deficiency, right? The next one, B vitamins. B vitamins are also affected. The absorption of B vitamins are also affected with people who take birth control. And so your B vitamins they involve metabolic processes in the body responsible for energy production and normal cellular function. Why is this important? Because the metabolic can be anything that is happening within your body systems. But let's just break it down to something as simple as metabolizing the foods that you eat. Metabolizing the proteins. Hair is composed of proteins. The whole body is composed of proteins. But since we're so focused on hair, I want to break it down to you where it land on you and you can understand how important vitamins and minerals are to the body in order for you to even produce hair, and how it has very little to do with your hair. It has everything to do with how you take care of your body at the end of the day. And so it metabolizes your proteins, carbs, and fats. And so if you're not breaking down, if you're not metabolizing the things that you're ingesting, the foods that you're eating, the supplements that you're taking, because you have deficiencies and you don't even know it, you're constantly taking the birth control pill or whatever method of contraceptive you choose, then you're constantly putting these drugs, these hormones, these artificial hormones in the body that's constantly building up in the bloodstream. And when it constantly builds up in the bloodstream, that's when you start having the issues. It's not because, everybody that takes birth control pills is going to have this problem. It depends on how your body responds. And there are so many types of birth control on the market that have different percentages of hormones in them. It just depends on the way your body responds to it. But these are things that I want to bring to your knowledge so that you're aware of it, so that when you go to the doctor, you can ask these questions. Doc, why don't you test my folic acid level? Test my B vitamin levels. Test these levels that I know can be a contributing factor to deficiencies in my body, especially if you're in childbearing ages, because just because you're on birth control, if you can have kids and you don't have any female issues, but you're on birth control because you're really not ready to be a parent and you're just being responsible, and then you decide to come off the birth control, that stuff has to get out of your bloodstream before you can even start conceiving. Because remember, the birth control is meant to trick the body and think that it's pregnant. Right? It's meant to trick the body and think that it's pregnant. It's meant to elevate the hormones that keep the body from going through the process that it's supposed to go through when you ovulate, you have a cycle, and you do all of those things. It's meant to trick the body. So you got to get all of that stuff out of your system first before you can even think about conceiving, right? And so when you come off of these birth control pills, say for instance, it's been years and you've been taking this, but you don't feel any symptoms. You don't feel like you're ill or like you're deprived of any vitamins or minerals. So you don't know, because you don't know the symptoms to look for. And sometimes the body can be giving you symptoms and it gets quiet on you because you didn't address it. You didn't speak to the body. You didn't answer the call when the body was speaking. So it becomes a normal feeling, a normal function for you. So you don't even take notice. But then you start trying to conceive, and then you get all this blood work done because now you're trying to conceive, and you find out that you have all of these other deficiencies going on. Or however you find out with your blood work, whatever leads you to get blood work, you find out later that you have these deficiencies. 9 times out of 10, the doctor is not going to go back in and tell you, oh, you have those deficiencies because you've been taking birth control for 15 years. They're not going to even go back in your medical record to even think to tell you that. Right? We have to be the better stewards over our body. We give the doctor too much power in that office, in those 10 minutes that they give us. We give them too much power to dictate and tell us what we need to do with our bodies when we're really just guinea pigs to them, right? So you have to take notice of the things that's going on with your body. You have to do your due diligence when you go in that office and you represent yourself. And if you're not sure about what it is that they're telling you to do, go research it. Schedule another appointment or a phone call, and then talk to them about the options that's best for you, right? So with that, vitamin C is another deficiency that you can experience. Well, vitamin C is a cofactor in a variety of metabolic processes. It includes synthesis of collagen, and it helps to maintain iron levels. Well, we know we need collagen to produce hair, or maybe we don't know, if you're a consumer, that you need collagen to produce hair. You need iron You need the oxygen levels in your bloodstream in order to produce the hair. Hair is the least on the totem pole, but I keep referring back to hair because it seems to be that important to you. So once we get over the importance of our hair and we start making it about the importance of our body, then we'll start having the hair on our head that we want. Right? So now I have to come to you on the level that you're on, and the level that you're on is constantly thinking about your hair. If it's growing, if it's not growing, if it's falling out, whatever the situation may be with your hair. So we have to speak in hair language. That's why today's talk is called Hair Talk, because I have to speak to you in hair language versus your body. But hair loss is a symptom of something else that's going on in your body. Zinc is huge. Zinc plays a role in immune function, right? It plays a role in DNA synthesis and gene expression. But the biggest thing for me, the DNA is huge, but where I want to go with this is the immune function. Your body can't fight off anything if the immune system is not functioning. Zinc is probably, I won't say all, but most cases of alopecia areata, there's a possibility that a person has a zinc deficiency. Well, we know alopecia areata definitely is an autoimmune response where the white blood cells is actually killing the hair cells. So with that, it's some of the time the zinc deficiency could cause alopecia areata with stress and a host of other things. But zinc can definitely play a role. A lack of it can definitely play a role with the way your immune system responds. It can weaken the immune system. So know that about deficiencies with birth control and vitamins. Selenium plays a role in functioning of the thyroid gland. The thyroid is like the matrix of the body. It tells the entire body what to do, when to do it. That little pituitary gland, that little pea-sized thing that sits on the brain, communicates with the thyroid. It tells the thyroid everything to do. The thyroid secretes hormones that send messengers to other body systems to do a certain thing. Too little secretion of the thyroid hormone or too much secretion of the thyroid hormone can cause an offset in the body, which can offset the hair cycle, right? Because everything that the body does, it functions on hormones. Hormones make the hair grow. Hormones make the hair fall out at the end of the day. And so selenium affects the thyroid gland in any cell that has thyroid hormone in it. That's huge in itself. And if you have a thyroid disease, like Hashimoto's disease or something like that, it can be, not that this is the cause, but there could definitely be a selenium deficiency. And once again, I'm not saying that that is the cause of the disease because it's multifactorial, but that is one of the things. And we always try to take herbs and vitamins that are going to try to heal us or keep things into balance. And that's something to think about if you have some thyroid issues. Magnesium is necessary for ATP production. Adenosine triphosphate. That is energy. That is mitochondria. That is where the cell is getting the energy to regenerate, to repopulate new cells, for mitosis to happen. And mitosis is where the cells are actually splitting. That is where all of that is taking place. If you don't have enough magnesium, you can be hindering the energy production within the cells, which could hinder the cellular regeneration process, right? And so you definitely don't want to hinder that. If you don't have enough energy, you get energy from the food you eat. You get energy from so many different sources that fuel the cells, and not just the hair cells, cells of all body systems. And so with that said, you need the energy. And this is why it's important to eat a balanced diet, because eating a balanced diet is the most organic way for you to get all of the vitamins and minerals that you need. Supplementation is in addition to, but we should not overlook a healthy diet and go directly to supplementing and think that we're going to be sufficient. You need to be eating a healthy diet. So all of this keto diet, this Atkins diet, all of these diets that eliminate different fats, different carbs, different proteins and stuff like that, you got to be really careful about the lifestyle that you're living, the diet. There's no such thing as a diet. It's called a lifestyle. And if you get accustomed to a healthy lifestyle, if you really get accustomed to eating 6 times a day, which is going to be 3 meals and 3 snacks, and getting your water in, you will have your metabolism revved up and moving so fast that it won't have time to store fat or anything else like that. Right? And so that's a way for you to be able to get a balance of everything. If you're vegan, vegetarian, and you don't really get a lot of protein, you need to figure out additional sources for you to get your protein. And I'll just say that not everybody is a candidate to not eat meat. I know it's a whole lot going around about eating meat, animal fat, and all that. It's a whole lot going around about a whole bunch of stuff, right? But pray over it and eat it. Pray over and eat it, because we don't know. We don't have control over any of this stuff. But what we do know is that eating a healthy, balanced diet will definitely keep your cells moving at a healthy rate for you to stay healthy. And so you want to make sure you're getting your green leafy vegetables, your protein, whether it's through animal fat or you're using other sources of protein. You want to get your fruits, you want to get your nuts, your lentils. Those types of things will help you get a balance. And don't mono eat. When we mono eat and eat the same thing, it becomes mundane. You get bored and you're not opening yourself up to receive a balance of the vitamins and minerals that you should get, because there's certain things that the body cannot produce. There's certain vitamins that the body cannot produce. And if the body can't produce them and you're eating a whole lot of processed fast foods, then your body is just going to be depleted of those things that it can only get through foods, because the body is not able to produce those essential things, right? So we got to do better with the things that's on the tip of our fork, because either you're on the tip of your fork, you're digging a grave most of the times. So just be careful. Just knowing that that birth control can cause a lot of these deficiencies. And the unfortunate thing is, when you go in to the doctor for this and you start telling them, oh, my hair is coming out. It's been cases of where people's hair have been coming out with the depot shot, acne, weight gain, all of these things, because it interferes with the hormone function. So anything that interferes with your hormone function, it can offset some things with other body systems, because your body already secretes certain levels of hormones. And if you start adding these artificial hormones to the body, and there's an influx of this stuff in your bloodstream and it can't bind to anything, there's an overload, and then the body starts reacting to that because it doesn't know what to do with the excess. So you just got to be careful. And the doctor is not going to tell you, oh, you have acne because you have an increased amount of androgens in your body. They're not going to tell you that kind of stuff. That's the kind of stuff that you learn trial and error because you go through it, or you learn that kind of stuff because you have somebody like me that advocates for women, and I research and I read, and then I come on my Facebook Live and I share this with you, right? So it's important to understand what you're putting in your body and the side effects that it has on your body. There are so many medications that have, side effects that a lot of times we have to take them in order to remain alive. But medications don't fix the body. They simulate the body's functions. Birth control, for Hey Nicola, a lot of, for some women, that is the choice because they have other female issues going on and they need to balance out hormones like polycystic ovarian syndrome, which is a case where there is excessive androgens that the body is producing on its own. So you have to be really careful. All the doctor did was prescribe more medication for my acne. Absolutely. That's what they do. That's what they do. They're notorious. And then that medication has a side effect. And it just goes on and on and on and on. And when are we going to take responsibility for what's happening? Thanks for the information. Very helpful for me. You're welcome, Vicky. You know, so that's why we have to go in there equipped and armed. And we have no idea how to be equipped and armed. That's why you have a Kai Smith. This is why you have a Kai Smith. This is why it's important to me to remain educated so that I can come to you and I can share this kind of information, so that not for you to know everything about everything, but for you to know enough where it will pique your curiosity and you'll go read more on it if it pertains to you. Or if you have a young daughter that you're thinking about putting on birth control because she's in at the age where, you don't know if she's going to be having sex or, whatever. You don't want to trust it. You don't want her to come up pregnant prematurely, or whatever. Thank you, Whitney. My daughter has PCOS and her insulin levels, testosterone levels, and weight increase have been so high. It's been crazy. Yes, PCOS definitely affects insulin. It affects the heart. It affects so many different things. Latasha, I don't know. What I would advise to you for your daughter, does she have any hair loss or anything like that? Is she on any kind of birth control pills? Well, and how old is your daughter? But I would definitely seek a holistic approach with that, because you want to get her balanced. You want to get her to a place where she can live with that, where she could be balanced in her body so that she won't be dealing with a lot of the side effects of it and the symptoms. So I would definitely research a holistic approach and get in the hands of a holistic doctor that can help you keep those symptoms at bay. I was saying if you have a teenage daughter that actually you're thinking about putting on birth control pills, or your OBGYN is telling you, it's time to put your daughter on birth control pills, don't put that stuff in your kid's body. They are still growing, especially if they're 14, 15. They are still growing. They are still maturing. They have not peaked yet. They definitely don't need that stuff in their bodies. If they have irregular menses or something like that, I would definitely look into a more holistic approach to see what's going on. Hey, Keisha, to see what's going on before I opt to the birth control pill. Most definitely, I will look and see what my other options are. And that's just how I feel about prescription drugs, period. I'm not anti, but I definitely will search high and low for an alternative method before I just jump to taking the prescription drug. And just turned 16, yes, the BC, her hair is excessive over the body, and pityriasis in the, pityriasis in the back of her scalp. What is her diet like, Latasha? You need to look at her diet to see if she's eating a lot of dairy, if she's eating a lot of foods high in fat content, poor fat content, I should add. You really need to look at her diet. You need to look at her diet too for the insulin levels as well. But the pityriasis, you definitely can control that topically, and you can control that in her gut as well. Somebody else said something. I'm sorry, my finger is in the way. Birth control pills gave me blood clot in my leg. Yeah, it's birth control. It can be wicked. And so they prescribe it so quickly without even testing you, without even asking you any questions, and then all of a sudden you start having a reaction to it 3 months later, and then all they do is just want to change the company that you're taking instead of really looking into what's necessary for you. And that's the part that I don't like. It's not customized based on what we need as women. We're made equally, but we respond to things differently. So education is always going to be king. But with that said, I just wanted to come and I wanted to share that bit of information with you. If you have questions for me as a consumer, then I would suggest that you go on yourhairlossadvocate.com. That's yourhairlossadvocate.com. Schedule a 15-minute discovery session so that I could see which direction you need to go in if you're a candidate to work with me with my 3-step process that I have for helping you with hair loss. Go ahead and have a good rest of your evening and make it a productive rest of your week. Be good to yourself. Good night.